Have you ever suffered from itchy raised welts or bumps that migrate about your skin from your trunk to your limbs, happening over days to months? This is actually a condition known as urticaria or hives. In this ensuing video, we'll be talking more about the causation and how to treat them. While hives may seem alarming or disturbing to some, understanding what causes them can be game-changing for most of us. Sometimes hives may only last a couple of days to even up to a couple of weeks and may spontaneously remit on their own. However, sometimes hives may be more long-standing and require more care, especially if they go into chronicity and spend more weeks to months. Do understand also that hives, while they may be pesky and annoying in the form of causing itch and irritation, they usually don't cause much more harm unless they develop into a form of angioedema which causes airway compromise. Now, sometimes hives can be more extreme and cause airway compromise. In this instance, there can be swelling over the airway. This is known as angioedema and requires more emergency care. There are many things that can give rise to hives or the onset of them. So firstly, there can be true allergies. For example, if you develop an allergy to nut or shellfish or certain medications, taking them will trigger hives, and hence withdrawing the medications will be helpful at aborting these attacks. Secondly, it can be caused by infections. So sometimes a bacterial or viral infection may actually set off an immunological response, and you can develop hives as a response to your immune system being triggered by this. Thirdly, stress can also trigger hives or make them worse. Hence, managing stress is very important at coping with this urticaria. Fourthly, physical triggers are very important to understand. Some patients actually get hives with regards to physical triggers like maybe hot or cold exposure. Sometimes it can be exercise-induced or even pressure-induced by scratching and tight-fitting clothing as well. Lastly, hives may also be a presentation of an underlying autoimmune condition. For some people, the cause of the hives may remain a mystery, and we call this idiopathic urticaria or idiopathic hives. However, there are some things that we can do to try to elucidate or figure out if there's any underlying triggers before we write it off as idiopathic urticaria. Now we get down to how do we investigate and find out the trigger of hives. The first thing to do is to keep a good diary. Keep a good food diary to help your doctor get a better idea of what may be in your diet that's triggering that. So come prepared, write down what you have morning, lunch and dinner, so that at least if there are episodes of hives that seem to have a diurnal or timing variation, we can then pinpoint to see whether there are common repeated triggers that may be causing these episodes as well. Secondly, after keeping a food diary and you go to see a physician, they may order a series of tests to help further delineate this. Baseline tests when urticaria stretches more than 6 weeks, or what we consider chronic urticaria, should at least include a full blood count to look for underlying infection, and also maybe include thyroid function tests because thyroid imbalance can also give rise to urticaria. Thirdly, a doctor may also want to screen for autoimmune markers. This can also be a presenting symptom of autoimmunity, hence screening a baseline test like the anti-nuclear antibody may be helpful as well. Going on to specific allergy testing, this can depend on what the doctor is looking for. So if they're looking for certain things such as a food allergen or an arrow allergen that's causing urticaria, they may order either a skin prick test, where basically tiny needles laced with the allergen are basically individually pricked on your skin to see whether that elucidates an immediate response. Other than using a skin prick test, your doctor may also order certain blood tests known as a RAS testing. RAS testing are available antibody tests to specific allergens in your food, such as nuts, seafood, as well as chicken, beef, for example, and also to certain arrow allergens such as grass or even cat and dog dander. So it can come in the form of either blood testing or in the form of individualized skin prick testing to every individual allergen. There can also be patch testing that is ordered as well. Patch testing is typically ordered when your doctor suspects a longer delayed response, or what we call contact urticaria. So in this case, you'll leave on patches on your back for 48 hours, and then you come in for a delayed reading to see whether there's localized swelling in the area due to exposure to a contactant that's applied on the skin. If urticaria goes away spontaneously in a few days, then you have nothing to fret or worry about. However, if they're bothersome and they really cause debilitating symptoms, it's important to at least start some management. First line will be antihistamines. Again, the severity will determine the amount of antihistamines you have to use. Some patients get away with just maybe using 1 or 2 types of antihistamines, and the hives are well controlled and go away after that. On the other hand, sometimes despite being on 1 or 2 antihistamines, there's still breakthrough urticaria happening throughout the day, and that's when you need to up titrate and definitely need to seek medical care for that. Sometimes a combination or maybe 4 or 5 different antihistamines may be necessary to exert an inhibition effect. It is important to do this daily until the urticaria calms down and you break the cycle before slowly, progressively weaning down the dosage of your antihistamines. Other than antihistamines, sometimes even oral corticosteroids may be required. This is when the urticaria is more severe, such as leading to angioedema or swelling with airway compromise, or sometimes when the urticaria is just very severe and cannot be controlled with antihistamines alone, a course or pulse of corticosteroids may be necessary to calm down the immunological response. Thirdly, identifying the triggers is important. As mentioned earlier in the video, we talked about various testing that can be done to try to look for any underlying trigger points such as allergies or even infections, and it's important to treat that so that the urticaria goes away. If the urticaria is deemed to be idiopathic and chronic and debilitating at the same time, where the urticaria cannot be controlled well with just a few antihistamines, then sometimes we can escalate management to using a biologic known as omalizumab, which is given once a month. Omalizumab is a biologic class medication that is given in the form of an injection, and this really helps to manage more refractory urticaria. So when do you need to see a dermatologist for your hives? One, when it causes more serious symptoms such as very extensive urticaria, causing maybe some airway compromise, some lip swelling, and some shortness of breath, you should seek medical care immediately. Secondly, when it's very chronic, when it seems to not go away, it's now lasting not just a few days but going into weeks, up to 6 weeks, that's when it goes into chronicity, and you should seek further care to see whether there's any underlying causation or any other correctable factors that can be done to try to improve symptoms as well. If your hives are giving you trouble, don't forget to reach out for help. You can seek help from a professional such as a dermatologist to better find out the causation as well as treatment of your urticaria. If you have any comments or any questions, don't forget to drop them in the box below. And if you like our content, don't forget to subscribe to our channel for more educational skincare and wellness advice and tips.